Hi, my name is Josefina Serrano. I'm a student at Gardening Academy. I had to perform some skills, so I'm gonna start doing my skills. So the first skill we're gonna do, it's gonna be how to perform oral care in a unconscious patient. Okay, so the first thing is I go into the room, put my hand sanitizer, go into the room, and then, hi, my name is Josefina. I'm going to be your nurse. So I introduce myself and I double check the patient's identity. So what's your name?
Katie.
Okay, so I double check her name, and then I'll explain the patient that I'm gonna perform oral care on her. So I'm going to perform oral care on you, okay?
Okay.
And then I need to get my supplies. Get my supplies over here, which is I'm gonna get a towel, a small basin, and then the mouthwash, toothbrush, and toothpaste. I put over here, have it ready. I lower the, I put the bed higher at my comfortable position. Put the rail down on the bed, make sure it's locked, and then I got the patients to turn to my side, with the side I need to be working on. So I put a towel here, turn the patient this way, and then put the little basin here, and I open the mouth, and then I use the toothbrush with the mouthwash, and then I put it back, front, up and down, up and down, up and down, and gentle in the tongue too. Okay, after that I rinse it. If I need a suction, I use it, or it depends on what patient I got. And then after that, I wipe her, remove all my supplies, put it away, wash my hands, and then lower the bed to a comfortable position, and then the rail up, okay, before I go wash my hands. So, and after that, I chart about what I did, if I found anything wrong or anything. The next skill is going to be denture care, which I use this one as a denture care, which is okay. So this is the mouth, right? So I'm gonna perform. So the mouth open. So I'm gonna use is to clean the denture. I go to the sink, but first of all, of course, I need to put gloves on, get my stuff ready, what I need, which is the towel, the mouthwash, the toothbrush, all the stuff that I need. Go to the sink, put warm water, not hot, not cold, just warm, and then start getting the, let's say this is the bottom denture, let's say that, and I grab it and I start brushing in the front of the teeth, all around, and then cleaning and also in the horizontal way in the back. I do the same thing for the top, and after that I dry it, okay, and put it in, give it to the patient, or I save it in a box. And after that, I wash my hands, put my gloves away, and do the stuff. And I chart if I find anything else. And the next one that I'm gonna use, the next skill is gonna be how to shave a male patient. Okay, so I come inside, I introduce myself, I put hygiene in my hands, I introduce myself. Hi, my name is Josefina. I'm gonna be a nurse today. And your name is Kaylee. I double check her name. And then I'm gonna say, okay, I'm gonna shave you today. Okay. I say, okay, it's fine. And I check the medical record number if everything's okay, the blood is okay, and everything. If you have any problems, and then after that, I get my supplies, my shaver, and then my creamer, or depend if you want soap or cream, shaving cream. I'm sorry. And then get my stuff ready here. I put the bed higher to my height, and I lower the rail, and then raise his head up, and then put a towel in here. I put a towel in here, and then I start putting shaving cream all over, But before sorry, I missed one step. Before I put shaving cream, I had to get the warm water towel and then put it in the face for a few seconds and then remove it and then put the shaving cream. And after you put the shaving cream, I had to shave him with the my dominant hand, which is the stronger hand. So with my less dominant hand, I just put the skin like this and then just shave it all over. And after that, I go change my gloves, change the water, and then get a new water. And then I get a wet towel, warm wet towel, and squeeze it, and then put it on top of the face. And then I dry it. And after that, I ask if you want a lotion or shaving lotion or anything. Okay? And then the last one that I'm going to do, it's going to be wound assessment, which is wound care. So I'm gonna come into the room again, come in, sanitize my hands, come into the room, and then that, of course, the patient needs privacy. And then I ask, oh, my name is Josefina, I'm going to be the your nurse today. So and then so it's okay, your name is Kaylee, and double check. So I'm gonna check your wound, okay? So let's say your wound is over here. I turn the patient to either that side or this side, depends where the wound is. So let's just say this is the wound. Sorry, I did this as a wound. So this is the wound, right? So I had to measure the depth. How do I do that? I have to measure the depth, but first I have to put it like a clockwise, which is the head is the 12 and this one is the 6. So how I'm gonna measure is from head to toe, which is like this, right? That's the length, that's the width, and this is the depth. So the depth I had to measure it like this. And then of course the skin is over here, so I need to measure the line. I got the depth one, right? So I had to put it like this, measure with the centimeters, how depth is that one. Okay, I checked that one. And then, but sorry, I skipped one step. So when I come and see the wound, I check, I open the soil dressing, remove it, check for liquids or any drainage, anything. So I go change my gloves, get a new gloves, and come back and assess that wound and check about any drainage, the same dry, moisture, how it looks the wound, right? And after that, I put the clean dressing, and then I put my the day of the time I put, daytime, and then my initials when I put the dressing. And after that, I compare it. After that, I wash my hands. I put the head up, the bed higher. And then I put the bed higher. And then I put the rail up. And after that, I wash my hands, clean. And I report. I report what I see to see if it's different or the same as the last report that the nurse did on that wound. Okay? And after that, this is it. Thank you very much.